All right, let's talk about bunions. People hear the word bunion, they think, oh, nasty, gross. Truth is a bunion is just a basic deformity of bone at the first metatarsal phalangeal joint. So if this is your metatarsal and this is your phalanx, the first metatarsal phalangeal joint is this guy. It's your big toe joint. And thanks to your mother or your father or your grandmother, grandfather, somebody, that bone is not very secure at this joint here, at the metatarsal cuneiform joint, and it starts to pivot. When that happens, the big toe is tethered by a bunch of big tendons, flexors and extensors that hold it quite tightly. So as you lose the metatarsal that way, the big toe is tethered this way, and you end up with that. Sometimes they can be very dramatic. I've had a number of little old ladies in my office where the toe is literally over here. Sometimes it can go the other direction. That's called hallux varus, but this is called hallux abductovalgus, which is really just a bunion. So that's tricky. When you have a deformity like that, people like to blame it on bad shoes, bad habits, and the truth is they've done several studies. I forget if it was Tonga or Samoa, but they went and studied these folks who rarely wear shoes, often wear sandals or go flip-flop, or barefoot, excuse me, and they had the same exact amount of bunion deformities as people who wore traditional shoes, athletic shoes or dress shoes. So it turns out that it's highly genetic. People always ask me, well, what can I do to prevent it? My mom had it, looks like I'm getting it, what can I do? There are a number of splints that'll hold the metatarsal a little bit straighter and will help correct that big toe and bring it back straight. The problem is as soon as you take that splint off, everything buckles back into place and it doesn't do any good. So unless you're willing to wear that splint for a long period of time, perhaps the rest of your life, that bunion's coming, and you're not going to slow it down. So unlike most of my therapies with bunions, unless a wider shoe, a softer shoe takes care of the pain that they get on that bump right there, it's often a surgical correction pretty quickly. So on that note, conservative therapy, wide shoes, really wide shoes, the toe box. There's a company in Utah called Ultra. They do running shoes. They've got the incredibly wide toe box that can accommodate a bunion pretty well. New Balance is great. They're a little narrower, but a good solid shoe that's wide and soft on the top. If that doesn't take care of it, sometimes an orthotic will. An orthotic is an insert that goes in your shoe. A lot of people are familiar with Dr. Scholl's. We're talking much more advanced than that. Dr. Scholl's inserts are really just pads. You either need a custom orthotic that's rigid, or at least an orthotic like a Power Step or a Super Feet orthotic. They need to have enough strength that in the arch they actually hold the arch up. I have had patients with significant bunions that get a good shoe, get a good orthotic, and discover that their bunion pain goes away and they're fine. It doesn't cure their bunion, it's still there, but it takes enough stress off that area that their pain's gone and they can avoid surgery. So today I had several patients come in and they asked about bunions. The reason to have bunion surgery is not cosmetics. If you have a bunion and it doesn't hurt, I guarantee you after surgery it's going to hurt. The pain may eventually go away and you'll have gotten away with cosmetic surgery, but I'm telling you, a lot of people end up with stiffness, a little bit of soreness, some problem they didn't have before, and they regret doing bunion surgery. So the big two reasons I do bunion surgery is pain. If pain's consistent, if you can't wear shoes that get you feeling better, if you can't wear reasonable shoes or can't find any that are getting you enough pain relief, then it's probably time for surgery. And the next big thing is as the big toe starts to come over here, if it starts to boss around the second toe and the second toe starts to buckle up like this or underneath, that becomes much more tricky to fix surgically. And I would much rather fix a foot that has a simple bunion than a bunion and now what's called a hammer toe or a mallet toe or some deformity of the second toe. The worst case scenario is when the big toe, the hallux, puts so much pressure on the second toe that it starts to buckle up, and it'll actually dislocate on top of the foot. When you reach that level of deformity, it becomes extremely hard to get that toe down and to keep it down with surgery. So those are your two reasons for surgery. I'll go over some x-rays here in a minute, but the most important thing to remember is that you don't do surgery for cosmetics. Okay, surgery, you've got two options, two basic options. There's about 100 different surgical procedures for bunions described out there, but they all boil down into two basic categories. Either you have a small bunion where this bump, the deformity here is only become a little bit, where the big toe is only dislocated just a little bit. The most common procedure for that is called an Austin bunionectomy. And what we do is we cut through the end of the bone right here, slide it back over where it belongs, and put a screw or two in there to keep it in place. That's pretty straightforward. An Austin bunionectomy, I think I was told once that it's one of the most commonly performed procedures in the US, but it's quick and it can be done in less than an hour easily. You can walk on it immediately as long as you're in a protective shoe. Bare minimum, it needs to be a very stiff sandal, a post-op sandal. I prefer to put my patients in a big cam boot. The reason being is with this, you can't push off of the forefoot. You can't put a lot of weight on your big toe when you're recovering. I'll put them in that for 4 weeks and then follow that up with another 4 weeks in a post-op sandal. And that usually buys you enough time that bone we cut through will have healed and you'll be in good shape. If the bunion is really big and this first metatarsal has wandered a long ways over here, to cut through the end of the bone and slide it over to correct it, it just doesn't, you can't get enough motion. You can't move it far enough to get it back where it belongs. So in my opinion, you either have to remove this joint here or cut through the bone way down here. Either way, you take a large wedge of bone out, a pie-shaped piece of bone, that allows that whole bone to swing back into place. Now, fixation for that type of osteotomy can be tricky. And one thing that is hotly debated out there amongst foot and ankle surgeons is that if the joint here, the metatarsal cuneiform joint, is the reason, its weakness, if that's the reason the bunion formed in the first place, then why not get rid of that joint or stabilize it? And that's called a Lapidus Bunionectomy. That's my favorite. It means we take a wedge of bone out that includes that joint. Once we've gotten rid of that joint, the bone falls back into the position, the straight position where we want it, and I'm eliminating, I hope, in the future, a chance for that bunion to recur. It's not perfect. Sure, it settles back a little bit sometimes, but most patients do well with a very good long-term outcome. My predecessors used to do far more Austin bunionectomies, the distal head metatarsal osteotomies, and a lot of them came back. There was a lot of disappointing outcomes. So I always prefer, if it's not a small bunion, if the foot's flexible, if there's a lot of motion here, I prefer to do the Lapidus bunionectomy and try to give them a long-term outcome. Now, if there's a reason they can't stay off of it, we may need to do the smaller bunionectomy, because with the smaller Austin bunionectomy, you can put weight on it. It's quite strong. As long as you're in the boot, it should be fine. But with a Lapidus bunionectomy, when we remove that joint, there's so much leverage here when you walk. I don't let my patients walk immediately. I know some guys do, but I've seen a lot of non-unions where the bones don't take and they have to revise surgery. So I just don't like to take that chance. And I'll put them in a boot, and I don't let them walk for at least 3 weeks, perhaps 4 to 5 if I have to put a little bone graft in there. But once they reach 3 to 4 weeks non-weight bearing, then they can walk in it as long as they're in one of these cam boots. So that's bunions in a nutshell. When we do bunion surgery, there are also several other things we'll do besides realigning the bones. Sometimes the big toe, the hallux, has a really sharp curve to it. If that's the case, we'll do what's called an Aiken osteotomy, where we take a small pie-shaped piece of wedge out of the bone, straighten it out, and put a little screw across it to hold it. Other things that we often do, the bone right here at the head of the metatarsal often grows really big, and so we'll shave off of the extra bone that's grown. And then what we'll also work on is tightening up soft tissues on this side that have been stretched out, and lengthening soft tissues on this side of the joint that have been contracted and shortened. If you do all that together, usually bunion surgery is very successful. If you're conservative and you only go for surgery if you're really in pain, often the outcomes are great. I hear a lot of people complain that their foot surgery was the worst thing they ever did. And I have to think that they probably weren't in very much pain to begin with, and their doctor convinced them they needed it for whatever reason. So I'm quite a conservative surgeon, and I have to hear that there's a lot of pain in a person's life, and it's debilitating to the point where they're avoiding healthy activities, or they can't fit reasonable shoes before I'll start thinking about surgery for them. In terms of fixation, the smaller surgery, the Austin bunionectomy, we're usually doing 2 little screws in there. My fixation of choice is using Paragon 28's phantom nail. I'll show you some diagrams, but it's essentially a beam that goes right through the middle of the bone. Use a complicated jig system that implants the beam through the metatarsal all the way to the cuneiform, and then there's two locking screws on either side, or 3, however you want to configure it, to lock it in there. It's all under the bone. It used to be we'd use screws, the heads would stick out, or the plate would be sitting on top with screws through the plate. And often women have this surgery and their foot is really skinny and they'll fill that hardware. So I've loved this innovation by Paragon, where I can bury everything under the bone and people don't even know it's there, and they don't care once the bone's healed. Once the bone's healed, you don't need the metal in there for strength, because it's bone fused to bone and you're good to go. Same thing with the 2 screws for the Austin bunionectomy. However, you don't usually need to take it out. I take x-rays for people who had bunion surgery 20, 30 years ago and they're fine, or doing it for other reasons, and they've forgotten the screws were even in there. So you don't have to take them out unless they hurt or they're a problem. And I believe the phantom nail has helped me avoid that in the future. I haven't taken any out yet. I'm sure that day's coming, but it seems to be a great system. As always, we are doing this for Operation Underground Railroad. The whole point of these discussions is to help you with your foot and ankle problems, but also to raise money and funds and awareness for Operation Underground Railroad. So please go to their website, OURrescue.org, make a donation. If you look it up, we have our own fundraiser under Dan Preece, DANPREECE. But it doesn't matter, make a donation. Remember, the doctor's visit is valuable, it's expensive, and if this has been a benefit to you, go to the website and make a donation equivalent to what you would have spent to see a doctor in the first place. That would be awesome. We don't see a penny of this. Everything is donated, and it's our pleasure to help fight child sex trafficking around the world. We hope to eradicate it, and we're doing our part. You guys have a great one.